Hi, I'm Dr. Nick Chretien, and I'm a sports chiropractor who specializes in soft tissue injuries. This video is going to help you understand why treating your soft tissues is such an integral part to keeping an active lifestyle and combating your repetitive use lifestyles. Today, we're going to learn what fascia is and why it's important. You'll learn what factors increase tissue stress called insult. You'll learn how the body responds to this stress. And of course, you'll learn exactly what you can do about it. Unfortunately, the study of trigger points has not historically been part of the medical education. It was 80 years ago that researchers who discovered and studied trigger points warned us that, quote, most common everyday pain is caused by myofascial trigger points, and that ignorance of that basic concept could inevitably lead to false diagnosis and the ultimate failure to deal effectively with pain. We must not forget this fact. It all starts with fascia, the connective tissue that runs between cells, groups of fibers, and entire muscles, and even organs. The imagery offered by Drs. J.C. Gumbertow and Ronald Thompson can give you a sense of the nature of these watery, webbed, sticky fibers in our bodies. Fascia has long been researched by Tom Myers, author of the Anatomy Trains. He found out that fascia runs in distinct patterns called myofascial meridians. The image on your left is what he calls the superficial backline. You can see how it connects the plantar fascia all the way up to the scalp. Think about what the myofascial meridians like this mean. Tightness in one area can pull up and down the chain, causing problems in other distant areas. Perhaps someone with chronic headaches could never fully address their source of headaches until the tight hamstrings were treated. Or plantar fasciitis, caused by calf muscles that are locked too tight. Tom Myers laid all this information out for you to discover in his book and in his coursework, where he teaches folks how to analyze their body and treat clients for balance in their myofascial meridians. This graphic is from the front page of his book, Anatomy Trains, and uniquely shows all of these identified myofascial meridians. This is pretty powerful stuff. I'm telling you, you could actually fix chronic pain in your thumb by fixing tightness in the pectoralis minor all the way up in the chest. You should remember this concept when repeated treatments of one area aren't working. You should look up or down the train using the myofascial meridians. Fascia is also responsive, responding to the outside and internal forces in the body, and potentially reproducing more of itself in times of stress. This is done by fibroblasts, which lay down collagen along lines of stress within cells, creating a sort of strap that we can see in the representation at the bottom. Of course, this adaptation is extremely helpful unless the stressor to the body is constant. Hopefully, it's possible then to imagine how a constant stressor would cause sticky surfaces that restrict range of motion, lock muscles into restricted positions, and even change normal biomechanical function. This is indeed what happens. Lock a muscle tight enough and you could even cut off its access to oxygenated blood that it needs to repair itself. Resting won't help because the muscle is too tight to get oxygen. Even stretching may not be able to target the tightest portion of the restriction. So it's really when the stressor to the body is constant or repeated that our body can get overwhelmed and foul up the healing process. Consider that in the course of a year, 50% of runners will suffer from some form of overuse injury that prevents them from running. Also, the injury rate for CrossFitters has been reported as high as 74% for non-season ending injuries. Even holding your head up while looking at the computer creates problems because those muscles don't get a break. So let's see what type of forces are creating those constant stressors. Dr. Michael Leahy, the founder of Active Release Techniques, derived a formula that determines what he refers to as tissue insult. The formula is referred to as the law of repetitive motion, where I is tissue insult, N is the number of repetitions, F is the force per contraction, A is the percentage of motion used, called amplitude, and R is the rest time between repetitions. Looking briefly at the formula, we can see that insult to tissues is highest when repetitions are high, when the weight is heavy, when rest is low, and when the amplitude or percentage of range of motion used is low. Let's check each of these variables out quickly so we can fully grasp this concept. To do this, I'm going to use what are called benchmark workouts, developed by the founders of CrossFit. First, we have Barbara, a bodyweight workout with 150 repetitions for 5 rounds, totaling a whopping 700 reps. At least they're spread across 4 separate movements. Well, similarly, you could see how a bartender pouring hundreds of drinks could overuse their arm muscles. Thousands of keystrokes while working at the computer could also cause tissue insult from high repetitions. Now, when considering force, the best way to think about it is heavy weight, though it's actually a percentage of maximal muscle strength. A heavy workout might be Linda, where a 200-pound man would be expected to perform 55 reps of a 300-pound deadlift, 200-pound bench press, and a 175-pound clean. Phew, that sure would take some force. Similarly, you could see how someone who moves furniture for a living could really be asking a lot of his muscles. Amplitude is perhaps the hardest variable to understand. The easiest way to think about it is the percentage of available range of motion you use. Full range of motion and the tissue insult is dispersed over many tissues. Just a fraction of available range of motion, and those muscles at that angle will receive most of the insult. Would you rather hold an air squat at the bottom position for 1 minute duration, or perform as many reps as you can of an air squat in 1 minute? Obviously, holding the squat at the bottom position is much more taxing on the body. Doing the air squat reps is going to distribute the force over multiple joint angles and keep your perceived level of exertion down. Diane is similar because it uses 2 movements that only use a small percentage of relative range of motion, the deadlift and handstand push-ups. The deadlift is accomplished by lifting weight only from your shins to your thighs, and handstand push-ups might only use a quarter of available range of motion. That's a lot of force distributed over a small percentage of range of motion. In the same way that the head falls in front of the shoulders in poor posture, these neck muscles are going to be contracting at relatively the same angle for many hours every single day. No wonder they get knotted up. I think amplitude teaches us another important concept, and that's how to protect our bodies when doing a high repetition or a heavy workout. Try to use as much safe range of motion as you can. This way you don't overwhelm the muscles at just one particular joint angle. On the other hand, bodybuilders can use this concept to their advantage by working muscles at one particular angle to make them bigger there. Lastly, there's the variable of rest time, which is the rest time between repetitions. Because this number is on the bottom of the formula, the closer the rest gets to 0, the more exponentially the tissue insult can rise. These are some of the benchmark workouts that bear the notorious AFAP, meaning as fast as possible. If we don't rest between repetitions, then pressure, friction, and tension are sustained and absorbed into tissues as tissue insult. Again, sustained poor postures can really escalate tissue insult levels, and this is because not only is the amplitude near 0, but because the muscles are contracting almost all day, there's very little rest between repetitions. Even the force is a high percentage of available maximal contraction for these small neck muscles. So this is why getting the ears over the shoulders instead of in front of them can help take away daily load on these tiny neck extensor muscles. My purpose of showing you what factors increase tissue insult is not to scare you, but rather create awareness and respect. The best plan is always to rest sore muscles and not work them vigorously again until they've healed. Ultimately, repetitive use can create myofascial restrictions, and you'll learn how to identify, isolate, and treat them all by yourself in this course. But first, I think it's imperative that you understand the cyclical nature of repetitive use injuries, where the symptoms and syndromes of what's called cumulative trauma disorders are self-perpetuated, all by simply using the tissue in question. The environment for an abused tissue gets worse and worse with use unless we step in and change the problem. Let's learn just what the problems are. The cumulative injury cycle was assembled from the work of Dr. Michael Leahy, the founder of active release techniques. Everything begins when our tissues absorb friction, pressure, or tension. This may be a workout. This may be holding your head up at your desk, and anything else that creates tissue insult that we just discussed. The tissue stress is absorbed in your body where it may potentially create micro tearing. Notice we're talking about the acute cycle, so right now we're talking about the first exposure to tissue insult. In response to tearing, the body is going to produce inflammation, which is characterized by pain, swelling, redness, hotness, and even impaired function, all dependent upon the severity of the microtearing. The inflammation helps recruit fibroblasts, and this is important. The inflammation helps recruit fibroblasts that deposit collagen and similar fibers to help stabilize the problem. The body reacts to this threat by sending more tone to the muscle under repair. I'm sure that you can imagine what a threat it would be to your body if you tweaked your hamstring and your body didn't tighten the muscle to protect it. You could have a full tear of the muscle. So now we're going to talk about what happens when the exposure to the friction, pressure, or tension occurs repetitively, like the squat movement each time you go to the gym, or holding your head up all day at work. Since we have the acute cycle that's also active, the inflammation and swelling will become overproduced and start to build inside of and around the muscle. As the swelling builds, pressure inside of the muscle itself will increase as well. Blood always flows from high to low pressure, and if there's too much hydrostatic pressure inside of a muscle, it will get less fresh oxygenated blood and therefore get delivered much less oxygen than it needs to heal itself. Since inflammation is a signaling pathway to recruit fibroblast cells, these cells start to overload the area and hang out around and inside the injured tissue site. The fibroblasts make collagen along with other fibers to serve to create the tissue knots that experts call adhesions. If the tissue has been ongoing for even as few as 3 months, the tissue can undergo fibrosis and change texture completely. Because this gluey substance is being deposited around a muscle that's already in a shortened position, the muscle becomes weaker and less capable of doing its job. The poor muscle no longer exists in an environment where it can heal itself. Each time the tissue absorbs additional pressure, friction, or tension, even more collagen is deposited around a tighter muscle. The muscle gets so tight that the low pressure vessels that drain the muscle are blocked as well. So the muscle gets much less oxygen, continues to build up in fibrosis, and further alienates itself from the body in a downward spiral effect. The only way to get tissue back to normal texture and function is by, you guessed it, soft tissue mobilization. Mobility. This is basically any manner of separating the tissue and fascia so that tension in the muscle decreases, swelling clears, and normal cellular functions are restored. I designed Mobility course online so that you can learn how to identify, isolate, and treat musculoskeletal problems all by yourself. This course will use monster bands, lacrosse balls, foam rollers, and voodoo floss, along with a few other cheap tools, to create profound changes in your body. This is mobility at its finest, all designed to be easily understood and immediately integrated into your habits so that you can prevent overuse injuries all by yourself. Let's be rock stars so you learn the practice of fixing your body so that we can live the glorious life free of pain, injury, and mediocrity. Now I give you the keys to the castle. Here we go. Hi, Dr. Nick here at MobilityWODShop.com. And if you're looking to follow through with the videos recommended in this unit, then I highly recommend you get the tools that you're going to need from us here at MobilityWODShop. We offer free shipping on all of our orders, and all the tools have been hand selected by me, Dr. Nick Chretien. I'm a sports chiropractor and soft tissue expert, and all the items you see are vetted by me as being effective for maintaining your body. Let's get your body feeling the way it's supposed to feel, and keep you recovering the fastest and seeing performance gains. So shop now at MobilityWODShop.com.